if it will connect. Okay, great. So welcome everybody to the bi-weekly COVID-19 meetup and check-in. My name is Amelia. I will be facilitating the meeting today. If you have not attended one of these before, you can, I'll be dropping some links into the chat box, so feel free to look at it there. And also, just as a reminder, you can save the chat transcript from this session. If you open up the chat box, you'll see that there's an option to type your message here, and it says to everyone, and then on the right-hand side of that little section, there's a file button and an ellipse, a dot, dot, dot button. And if you click on the dot, dot, dot button, you can save the chat. So as a reminder, if you want to save the chat, you can do so. All the links that I share and that other people share, I will also include in the description box in Vimeo later on. So our agenda today is to do our 3 deep breaths, to talk about a bit about the Realm Project Round 4 test results, a couple of updates on some COVID topics that I've brought up in the past, talking about COVID data from the CDC, and then doing some announcements and resources. And we'll also have some time for free discussion, so anything that you want to bring up, feel free to do so then, but you can also bring up anything that you would like at any point in time in this webinar. You can either unmute yourself or you can type something into the chat box, whatever you're comfortable with. So the first thing to do is our 3 deep breaths, and our picture today is supplied by Tracy Cook. It's Cracker Lake in Glacier, and it's very beautiful. And since I know that a lot of us are experiencing some smokiness right now, let's try and channel this energy of crystalline, clear, beautiful mountain lakes as we do our 3 deep breaths. So if you could sit up straight, bring your shoulders back and down, and really try and breathe into your belly instead of just using your chest. So instead of your shoulders going up and down, try and make your belly go forward and back. So breathe in and out. In, out, in, and out. Awesome. So the first thing that I wanted to talk about was the Realm Project Round 4 test results. So for those of you who are not familiar with the Realm Project, this is a research project that was commissioned by WebJunction, and they're working with a research group called Battelle, and it stands for Reopening Archives, Libraries, and Museums. And they've specifically been testing different library materials to see how long it takes for COVID to it's not disintegrate, to become undetectable on these materials. So they're planning on doing 5 rounds of testing total, I believe, and they've just finished and released the test 4 results, which were published at the very beginning of September. And so the reason why I brought this and bringing this up is because a couple librarians reached out to me because the test 4 results, they tested a hardback book cover, a soft cover book cover, a plastic protective cover, a DVD case, and expanded polyethylene foam, which is what you use to typically pack things. And in this particular test, they actually stacked the items, which is, I think, a pretty common configuration of materials in libraries. And so the test 4 results highlight the effect of stacking and its ability to prolong the survivability of the COVID virus. So in previous test results they've done, the virus has become undetectable after 3 days, or I think in one materials case, maybe 4 days. But in test 4, when they stacked it, it took, I think the virus was still detectable after 6 days. And so they released that information. And so a few libraries were wondering if they needed to extend quarantine times or what other libraries were doing. It's important to keep in mind, though, that they're conducting these experiments in a lab, in an artificially created environment that's meant to mimic a typical office library environment in terms of like humidity and temperature, et cetera, et cetera. But it's all at like a very controlled situation. So there's a lot of room for variability depending on where you live, what the climate's like, et cetera, humidity levels. And so even though it says 6 days, that's not necessarily, I don't think that's necessarily cause for alarm. I did reach out to other state library folks across the country to see what their libraries were doing. A couple of people have said that some libraries have extended the quarantine to 4 days. In other cases, though, a lot of libraries just weren't able to logistically make that work with their current workforce and space restrictions and things like that. So combined with the cleaning that they do, such as wiping off books, et cetera, they felt pretty confident that this wouldn't pose a huge risk. It's also important to know that even though the virus was still detectable after 6 days, it was a very small amount that was detectable. And we still don't really know what exactly is the viral load limit of what people need in order, how much they need to be exposed to the virus in order to contract COVID. So it's kind of hard to say whether or not this is significantly contributing to that. But I think even though these test results did come out and there was some discussion about it, from what I've heard, it hasn't changed a lot of what libraries are doing, and people are continuing with their current protocols and procedures. So I wanted to bring that up to all of you for consideration, to see if any of you had any questions. In terms of libraries in Montana, there are a couple of libraries who have longer quarantine times, but I think a couple of them had that from the very beginning. So even before the Realm project existed, they just chose to do longer quarantine times. For the most part, libraries are still doing the 72-hour quarantine, which seems to be the standard. Jennifer says, in Kalispell, we were doing 5 days. So yeah, and from the state library folks who responded to me, people were saying that people had increased, if they did increase times, it was either mostly to 4 days is what I saw. But occasionally some people were doing 5 days as well. So let me go ahead and drop these links into the chat box. The first one is just the main homepage for this project if you'd like to read more about it. I do encourage you to read the actual results. Obviously, I paraphrased a lot of things in this slide, but in the second link, you can find the test for results in the actual PDF where they publish everything. So I'd recommend reading that. And then I'd also, if you do still have concerns, I'd recommend talking with your local health department official. And seeing if you can come to solutions with them. So any questions about that? Okay, if you don't have any questions, that's great. If you have any other things you'd like to discuss, feel free to reach out. I think they've started on test 5, which you can read about on the homepage of this project. And typically they tend to release the results at the very beginning of the month. So I expect that we'll hear about test 5 results sometime in the first week of October. Let's see. Jennifer said, they thought with our 5 days we were okay, especially when we don't know how viable the virus is after that many days. Yes, Jennifer, that's a really good point. Again, even though the virus was detectable after over the 72-hour quarantine, I think it's still in pretty small amounts. And that in combination with a lot of the cleaning that people are doing, I think renders it pretty risk-free. So next topic is updates on COVID research. And so this is just, I've mentioned a couple of topics in these meetups in the past. So talking about airborne transmission, talking about COVID testing, that sort of thing. And since those are two sort of developing situations, I just thought that it'd be good for me to keep an eye out on anything else that comes out on these topics to see how the situation develops. So I did find this article from the New England Journal of Medicine from August 6th, and it talks about false negative tests for COVID and the challenges and implications. So this wasn't really necessarily like a study or like an experiment or anything like that. But this was just sort of experts talking candidly about false negatives and how this might be, how it can affect our battle against COVID. So I will be keeping an eye out for other articles and other information that come out on these topics. And I'll make sure to bring that up to this group if there's information that is new. But so far in this article, a lot of the stuff is pretty similar to what I had mentioned regarding the false negatives. They're still not really sure what the exact rate of false negatives are. And so there was, let's see, Jennifer said, there was something I saw was testing and your cell phone. I have not seen anything on that, but if you can remember what article that was, feel free to share that and we can take a look at that. But let me go ahead and share this article in the chat box. Okay. So any questions on that topic? Okay. Onwards and upwards then. So another topic that was brought up at a previous meetup was sort of federal agency data reliability. And I think this is in regards to the CDC and sort of conflicting messages that have come out from the White House and the CDC and other federal agencies, and some, to be frank, kind of shady policy changes or practices that these federal agencies have done. And so people were sort of worried as to how reliable COVID data was from the CDC and how that would affect how we share information. And so I was looking a little bit into this, and basically the case counts from the CDC are still accurate. The information about COVID, about symptoms, about testing and how the tests are done, kind of all of that, like, you know, description information, that is all still accurate. And the case counts are still accurate because those are actually taken directly from state agencies. And state agencies all compile their own information. There's not really any federal interference or oversight on that. States have their individual systems for collecting and publishing that information. I think what people sometimes confuse with the case counts is the hospital data. And this is something that I did mention in a previous meetup. The hospital data information is still in limbo. And the issue there is that before July 2020, for COVID and for other pandemics and for other just disease information, hospitals there was something called mandated reporting for diseases. So for certain diseases and conditions, hospitals, when they admit a patient with that condition, are required to report it into a system. And before July 2020, that system was housed at the CDC. I think it had been in existence for many, many years, I think actually decades. And that system was sort of co-created between the CDC and the hospitals who participate in terms of how data is input, how it's checked, and how it's published. So it was a pretty well-oiled machine. And so that's what, when COVID came around, that's what people and hospitals were inputting their data into. And that data refers to how many people are put on ventilators, how many people have co-occurring conditions, or how many people are in the ICU, how many ICU units are still available, that sort of thing. And the hospital data is important because that gives experts and analysts a general idea of how, quote unquote, well we are doing against COVID, and also how much capacity a certain area or a certain hospital has for treating COVID if there's like an outbreak or something like that. So that's the hospital data gives a much clearer picture in terms of the actual status of an area's response to COVID and how it's doing, as opposed to just straight case counts, tests done, negatives and positives. However, in July 2020, the White House decided to create a new reporting system and mandated that hospitals had to switch into this new system. And the way that it was done was very quick. I think hospitals were given 2 days to switch to a new system. I think I remember reading that federal funding was made contingent upon switching to this new system, but actually I'm not sure about that part. But there was considerable pressure placed on people to switch into the new hospital reporting system. And that information would be fed through the White House Coronavirus Task Force and then published through DPHHS. However, they have seen already that there were lots of inconsistencies. The data set was not updated properly or updated frequently enough, and which is just kind of unfortunate because that public data is what people use to analyze and understand how COVID is developing in the States. So the hospital data part, all of the information that the CDC system collected up until July 2020, that is still, I believe, available on the CDC website, but at a certain point it's not really helpful anymore because it's not giving a current look at the data that is coming in today. I think there has been a lot of criticism and a lot of just not a lot of transparency about why this new system was put in place, et cetera, et cetera. And so the jury is still out in terms of how this new system is working and whether or not they'll go back to the old system and how that will affect things in the future. So I did include this Associated Press article from August 28th, talking about health agencies' credibility at risk after a week of blunders. And so this was talking about a little bit about the CDC, but also about the FDA, and sort of, I think it's important to keep in mind that within the CDC and within these federal agencies, there's probably a lot of like internal, not necessarily strife, but just internal discussions on how to best handle pressure from the White House, which I don't think it's too much to say that the White House is pressuring certain agencies to present information in a certain way. And for example, I think one of the things that they mention in this article is the fact that CDC testing requirements were changed, very quietly changed, and policies were kind of changed to require less testing. But that actually happened when the head of the CDC, Dr. Fauci, was in surgery. And so it was kind of approved without his knowing. So I do think that I understand the concern for the credibility, and I think this Associated Press article does talk a lot about how, because the pressure from the White House is quite considerable, and a lot of these agencies depend on their budgets from the feds. There's that kind of tension there, and I think they're trying to balance that. But I think it's also important to know that certain data still is reliable, and certain things are still a better resource and information source compared to others. So you can go down a pretty deep rabbit hole with this, and there is a lot of stuff that's happened. This Associated Press article talks a lot about the FDA. In particular, it talks a lot about the FDA approving certain quote unquote COVID treatments that President Trump has sort of latched onto without a lot of data. And that's not to say that these are, well, and I think in some cases, some of them have proven to be not great. But with any new treatment, there's a lot of testing, there's a lot of research, there's a lot of development that has to go into it. And the FDA has sort of fast-tracked these and perhaps bypassed a lot of those checks. And so it's an interesting look at kind of the tensions that are happening in terms of differing agendas between certain federal agencies and perhaps the White House. So that was a really, really long, rambly answer because it's a rather complicated question. But I hope that gives a little bit more context to the fact that the CDC is still a reliable source of data, but also what other parts people have concerns about, and how, it's important not to conflate the two. And in the case of the CDC, in terms of case counts and the hospital data. Let's see, Joe said, speaking of data, I'm in Virginia, and this state has an app that will tell you if you were near a person who recently tested positive. It's all voluntary, and I don't know how successful it's been in helping, and here's the info. And she included the link there. So, and she decided to give it a try while I'm here just to see how it works. So thanks, Joe. Thanks for sharing that. And Jennifer, is that what you were thinking of in terms of testing and your cell phone? I'm not sure if that's exactly what you were thinking. Any questions? Okay. All right, so and this ended a lot earlier, so it's 3:30. This is just a time for general discussions and questions that you all might have. I'm not sure if anything has changed since school has started in a lot of communities, but feel free to talk about that. And if there's anything else that you'd like to discuss, this is now just open time. Jennifer said, no, this was earlier today, and it was about finding out quicker about the test results. Okay. Well, I'll make a note of that and see if there is, do some searching and see what might be out there about that. But if anyone knows what Jennifer might be talking about, feel free to share as well. Jennifer said, I haven't found it yet again, seeing stuff from May right now. I know, isn't it infuriating when you're like, I know I saw that somewhere, and I can't remember where. Let's see, Debbie said, are most libraries in Montana now in the limited hours open phase? That's actually a good question. Let me check the MSL services map. Let's see. Okay, so let me expand this. So it looks like most buildings are open with restrictions. Some buildings are open with no restrictions. Stuff in the chat box. Lori from Dylan says, Dylan has been open regular hours since June. Debbie says, the library director in Kingman has been very interested in watching Montana libraries and their open hours and service. And Debbie, I'm gonna drop this link into the chat box. Feel free to share that with the library director in Kingman. That's kind of overview of the library services and status of libraries here in Montana. And so there's a little pie chart that talks about building restrictions in particular. And so she can take a look at that. This map is only as accurate as it's a self-reporting thing. So you can see on the right-hand side of the map, you can see when a library last updated. But some libraries haven't updated in a while just because they haven't had a chance to submit another entry. So just keep that in mind, that this does give you a general idea, but it's not necessarily 100% accurate. Jennifer said, do you have an article about bandanas and gator masks that says they aren't that great? This is like tickling something in my brain. I think this actually came up in a previous meeting, and I think there was something on like the CDC website or something like that talking about face coverings and masks. I'll try and find that again for you. But I think there's considerable information out there on what types of face coverings work and which ones don't. They say face shields are not a good one. So if anyone has articles that they know off the top and would like to share, feel free to. But Jennifer, I'll take a look. I think they are there's something in a past COVID meetup. So.
There was something, I think, on our local news last night, and of course I won't find it now that I'm looking. No, from a guy from, oh, that's talking about smoke. Sorry, that's not it. That's the wrong thing. Anyway, somewhere I saw something about masks, of course, just the other day, but will I be able to figure out where I saw it? No. Mm-hmm. But they did say how the neck gaiters are not as efficient or useful as regular cloth masks that are a little tightly woven and maybe have a couple of layers. So
what is a gator mask? I'm just realizing that I don't know what that is.
I think it's one of those you can pull up. It kind of looks like a bandana, and you put it down and you
like
put
a
it up.
stretchy material?
Yeah, that's what I've been assuming.
Okay, Jennifer says yes. I read that and I was like, wait, I don't think I know what a gator mask is.
Then there was something called a face buff, what I didn't really know. That's the article. Let me, or the news thing.
Those are the same things.
Same thing. Okay.
Yeah, good. And it's when I read, if I remember correctly, it had to do with the material that they're made of, which is really kind of stretchy, and it's a light material too, for the most part. So the idea is you kind of wear it around your neck, and it's then you just pull it up over your nose when you want to. But that they've been used by like hikers and outdoorsy people as kind of a neck warmer, kind of light neck warmer for a long time.
Lori says that a buff has different thicknesses and it's spandex material. And Jennifer says, I believe it is the brand Gator. So kind of like a Kleenex in a face tissue. Any other questions? I guess another question that I have is, so right now we have 15 participants, and I've noticed that there's been a slow drop off of attendees for the COVID meetups. So I'm wondering if these are still helpful to people, if we should still do them every other week, or maybe start doing them once a month. What people might prefer. Jennifer says, I think they forget. I could see that. There's a lot of stuff going on. And Jennifer mentions some have to listen later on Vimeo. Gail says, I think every other week works. Information keeps updating. Dawn says, these meetups have been helpful, but I would appreciate doing it on a monthly basis. So we got one for every other week, one for monthly. Anyone want to play tiebreaker?
Maybe switch to monthly for now, unless, I don't know, some things change drastically and people feel like they need to talk about other things more. And certainly people can email you or us or whatever if they say, oh, I wish we could have another COVID, or when's the next one? Then we could schedule another one in between.
That's true.
I would say too, if information is suddenly, something drastic happens, or you're suddenly thrown into shutdowns again or whatever.
Right.
Then it makes sense to schedule it, but maybe just have the monthly one. I mean, gosh knows we're all doing an awful lot of meetings, and this all got started because we had a website chat scheduled, and we're like, let's just make this all about COVID, and everybody needed to meet more often, especially early on, to just be able to get information and figure out what was going on, and to just keep in touch with each other, which is really nice.
Like Jody says, it's harder now that people are open more and resuming regular services and hours. So I think maybe a monthly one might be easier for people.
That makes sense. Okay.
Yeah.
In that case, I'll probably schedule the next one for a month from now. So we'll do it mid-month. That way we can have the realm results posted, because those are usually posted at the beginning of the month. So, okay, I will announce that to people and let them know. And if there is demand for a meeting in between, we can always do that. Jennifer says we are still having lots of mask issues. And Jody says we could have special sessions called when there's new information to discuss or share.
Sure.
So yeah, that could definitely be
That's a great idea too. Yes.
Mask issues. I'm sorry to hear that.
Yes, that's so sad.
Well, I'm trying to find a presenter for fall workshops to just kind of run through what we know about how to diffuse those kind of difficult conversations with people, and so working on that. And just a reminder, we're having a session tomorrow on those mobile hotspots. I've got a little panel put together. So if you've got your hotspots and you think you should be doing more with them, or you just don't know what to do with them, or you've started doing some things and have a lot of questions, there'll be a session tomorrow morning at 10 o'clock. And I found a couple of presenters from North Carolina. They've been doing a hotspot program that's the state library's been running with their libraries for a while now. And they had lots of ideas they're happy to share. So they're going to do a quick presentation. And then I think it's Kalispell, Imagine If Libraries, is going to do a quick presentation of what they've been doing. And then the rest will be kind of a fun question and answer, free for all. So 10 o'clock, so come join us for that. And I think there's a website chat this week too. It could be it's just a busy week.
There are a lot of webinars this week.
Yeah, so the website chat's on Friday, and what? There's something special going on there. Oh, I think it's. He is coming. I'll have to look up my. It's in Aspen. Who's going to be there? But I think it's library statistics and a kind of report from Jessica, if I remember right. Could be wrong about that though. Quote me.
Lori said in the chat box, I'm strict if people come in without a mask. I politely remind them that I don't have to let them use the facilities. We sell masks to those who do not have them.
Oh, I'd be interested to know, how much do you charge? You know, I have to tell you, over here in Virginia, there's just really no mask problems. Everybody wears one. Everywhere, for the most part. I suppose there's got to be places, but I haven't run into any. Paper $2, cloth $5. Ooh, and the Dillon.
Oh, but a Dillon library mask. Boy, I wish every library had like their own mask. Wouldn't that be cool?
That would be cool.
I would buy one from lots of libraries. Like Dawn,
gotta
if you
collect
your
them
library,
all.
yeah, I would get one from Glendive. I would love it.
Suzanne is actually running the webinar tomorrow. She chimed in. She said, if you're doing great things with your hotspots and want to share, please come. Yes, she's our resident hotspot guru.
Yes, and I am going to stick the Aspen event page for the hotspot webinar in the chat box. So if you want to register for it and get the Zoom link and everything, you can do that there.
And yeah, we will be recording it. So
yes.
Oh, Joy has
Stonechild College. Oh.
Okay, everybody needs to wear their face masks next time. We'll have a fashion show.
Yeah.
Mm-hmm.
And we want to order your face mask.
Yeah, for sure.
so we can have a collection.
That's right.
Yeah.
Posterity. I mean, 50 years from now, there'll be like museum displays about
exactly of all these face masks.
COVID, and there'll be like a whole one with all the.
Or we'll be wearing them all the time because the air will be too.
It's so awful.
A couple other things I wanted to announce. So there is an updated webpage for the Hotspot Lending Program. It's the same URL. We just organized it a little bit better. And there's more marketing material. So if your library is participating in the Hotspot program and you're like, I really wish I had a Facebook or Instagram post template or a just regular letter-sized paper poster template, those are available now on the website, and you can change things and alter things on there. If you have questions about altering the templates and things, feel free to let me know. But we will probably be adding in more information to that website as the program develops. But just letting you know that you should, if you're participating in the Hotspot program, you should bookmark that website. And then also, I wanted to share, Jenny shared this with me, and this is just a new updated version of the, oh, darn, Lori says the Facebook and Instagram template link doesn't work. Darn it.
Oh no, because I thought I thought I looked at those, but maybe I saw them like, I don't know, in your, I thought they worked. But
I will say, Lori, it doesn't open to a new tab. It downloads to your computer. It's a PowerPoint file. So maybe if you're expecting a new tab, I'll still check that though afterwards.
Yeah.
But the link that I labeled number 6, this is an updated reopening FAQ from Montana, and it talks, I think it's updated with school reopening stuff. So I think that got updated in the beginning of September or something like that. And Jennifer asked, so are you going to go once a month? And yes, I believe that is what we are going to do.
And I am sorry, Lori is correct. The link does not work on those templates.
Well, great, Lori. Thanks for clicking on that.
Thanks for telling us now.
Yeah, I'll have to go and fix that.
Yeah.
If you guys find any other links that aren't working, let me know.
We always like a chance to fix things.
Yeah, exactly.
Sometimes the first thing to fixing it is knowing that it's screwed up.
Yeah.
Yeah. And actually the address looks good, Amelia. So I don't know. You'll have to work on that a little.
Hotspot marketing grayscale.
Yeah, so the website chat I did check on Friday, it's actually all about how we're spending leftover LSTA funding and gear funds. So you can find out how we're spending your tax dollars attending on Friday at noon, as usual. And those will be recorded and posted. I always get those posted right away. One thing nice about Virginia is I have excellent internet service. Uploads go like lickety split. It's amazing. Yeah.
Also, I'm clicking on all these links and none of them work.
You know, there was some update over the weekend, and I'm thinking maybe they did something and broke all those links, you know, at the state level or something.
Darn, because I was like, did I imagine?
Yeah, no, I don't. No, yeah, we checked them. Yeah, I think
like...
there was something where they did something this weekend to UDWs or something on the network. Something went on this weekend, and I think they messed up your links.
I see. Okay.
Because they can't all be broken like that. Because I know I had looked at them.
Mm-hmm. All right. Well, I will go and take a look at that and check. Lori says the press release works, so that's great.
Oh, good.
Yay! And then Jennifer asked, we were asked whose authority do we follow about masks? And is that a question, or is that just like you saying someone was sort of questioning about this? I think the state library has always said, you know, following, I mean, the governor's office has given the mask mandate. And that's,
I think a lot of times we say your local health department guidelines. Also.
Yeah, and Lori says your library board as well.
It was probably also going with the local health department, I would think.
Mm-hmm.
The local health department's guidelines take precedence over the state if they're more restrictive.
That's exactly right. Yeah, thanks.
Yes.
Yes, that's exactly right. So you use the state guidelines, and then whatever your local county or tribal health department, they're stricter. You use those.
Joy says, we always say the tribal chairman passed a resolution.
That's an excellent answer.
And Cindy, I think you had typed in...
I feel like she's cataloging a book.
Yes, I just wanted to make sure that it wasn't a question that you wanted to ask or something. I don't know. Jennifer said this was a customer that didn't like our rules. And I kind of feel like in that case, I think even if they were like, even if you said, I don't think they'd be happy with whoever you said. I think in certain cases they're asking a question and they're not actually really paying attention to the answer. They just want to have an opportunity to engage, I think, on their terms.
Yeah. And that's when you just stick with, you know, we have these guidelines and I can get what you want, but I can't let you in if you don't have a mask. And that's, you just have to keep sticking to that and be really pleasant about it and say, I'm sorry, I can't let you in, but can I get you something? Just be really friendly and polite and just say the same thing over and over.
Yeah, and offering to help them out another way is what people have told me seems to work the best. You know, when you are, you can call me on your phone. Here's my number, and I will be happy to go and get your books for you and bring them out to you, or you know, some other way of accommodating people.
And Jody says, in Red Lodge right now, it is in keeping with our public health guidelines and state guidelines. Our board did pass a policy requiring masks, and we used that before the mandates. We will return to that if the other mandates are lifted. And then Joe put in a governor's directive.
Yeah, and technically that's to the press release, and
Mhm.
but there's a link at the bottom of the press release to the actual directive. I didn't realize that till I.
And then Lori said,
A
ask them
lot.
politely.
Yeah.
Ask them politely to leave or get a mask, or you are more than happy to have the authorities escort them out.
Yeah.
Ooh, Lori, I love it.
More than happy.
And Jennifer said, shouldn't all kinds of businesses being offered accommodations? Shouldn't all kinds of businesses?
Yeah. Many are.
Well, they
I mean,
should,
you can do a lot of restaurants or stores are offering curbside service, you know,
Mm-hmm.
and not everybody, but you know, like I know of, like even the big box stores, Lowe's, Home Depot, you can order your materials and call customer service from your car and arrange to pay for them and pick up material without walking into the store.
Mm-hmm. Yeah, that would be ideal. I think Jennifer said the DMV wouldn't. I had to go in, and I guess that's kind of up to the business or the organization and what they're okay with,
Or what they're able to do also.
or what they're able to do.
Yes.
Yeah.
If you're getting new license plates for your car, maybe they could bring them out to you. But if you have to get a new driver's license or something, I bet they need you to come in so they can be on their computer or something. I mean, it depends on what they can do also. And we are much more accommodating. We can do a lot. We are so helpful.
Mm-hmm.
Montana's numbers are still rising, so. That's a concern.
Any other questions, comments, topics?
We'll stop so you can get to work on fixing all those links.
I know. It's like an itch now. I'm like, oh, I gotta fix those links.
Yeah.
All right, I'll stop the recording for now.
We are